What is binge eating disorder and how is it treated? While most of us overindulge from time to time on our favorite foods, binge eating disorder is much more than overeating or turning to food for emotional eating when you're depressed or sad. It's characterized by recurrent binge episodes where you eat much more food than somebody else would in a short period of time, such as a 2-hour window. This is accompanied by a feeling of a loss of control, like you can't stop even if you wanted to. Binge episodes are also associated with at least 3 of the following criteria: eating much more rapidly than normal, eating until you feel uncomfortably full, eating large amounts of food when you're not physically hungry, eating alone because you're embarrassed, and feeling disgusted, depressed, or really guilty after an episode. These binge episodes cause significant distress, and they occur at least once a week. But importantly, they're not followed by vomiting or extreme exercise like we see with bulimia. In terms of what causes binge eating, there's many different potential contributors, but we know that eating food can release feel-good hormones like dopamine and serotonin, and they can help numb distressing emotions that we're experiencing. If you feel like binge eating disorder applies to you, you're certainly not alone, because it's actually the most common eating disorder, and there is treatment available. The foundation of treatment is often psychotherapy or talk therapy, and this can include cognitive behavioral therapy or interpersonal therapy. It's often combined with medications such as Vyvanse, which is approved for the treatment of moderate to severe binge eating disorder. Sometimes other medications like antidepressants or topiramate can also be helpful. Another tool that can be beneficial is keeping a journal or a diary, tracking your emotions, and starting to recognize patterns or triggers that might lead to a binge episode. It's really important to have a treatment plan that's individualized and tailored to your own needs. So make an appointment with your physician to get started on your path to recovery.